Over 60? If swollen ankles or heavy legs slow you down, this will help. I'm Doc, a surgeon who works with older adults every day. Today I'll show 4 gentle surgeon-approved ways you can manage leg swelling at home and feel more comfortable. These are practical, safe, and based on guidance from leading health bodies like the NIH and CDC. You'll learn simple movements, nutrition tips, and safety checks that fit into a short daily routine. Start slow. Modify when joints bother you. If you have sudden, painful swelling, shortness of breath, or a known heart or kidney condition, see your doctor first. This is educational, not medical advice. Stick with me. Do the small steps. And within weeks, many people notice less puffiness and more steady legs. Let's begin. I'll guide each move and offer gentle modifications today. Why does this show up after 60? Here's the short, practical answer. As we age, 2 things often happen together. You lose a bit of muscle mass and your circulation slows. That age-related muscle loss is called sarcopenia. It weakens the calf pump that squeezes blood and lymph up from your feet, so fluid pools in the ankles more easily. Research and patient guides from the National Institute on Aging explain how muscle loss and reduced mobility raise the risk of swelling and falls. Other common causes aren't about age alone. Veins can become leaky or weak, chronic venous insufficiency. Medicines or a high-salt diet can make your body hold water, and conditions such as heart, kidney, or liver disease can also produce persistent swelling. Deep vein blood clots sometimes cause sudden, one-sided swelling and need urgent attention. Trusted clinical sources list these causes and the warning signs to watch for. The good news: motion, targeted strength, and small diet changes can reduce pooling and improve how your legs drain. The Physical activity guidelines recommend multi-component activity for older adults, aerobic, strength, and balance work, because moving regularly helps circulation and overall health. Studies show strength work is especially powerful. Meta-analyses of resistance training report substantial gains in muscle strength in older adults, which supports the idea that even simple, regular leg exercises can improve the calf pump and reduce swelling over weeks to months. That's the physiology in plain words. Weaker muscles and slower flow let fluid collect. Medications, diet, or medical conditions can add to it. Food and gentle moves work together to help. If swelling appears quickly, is painful, red, or you feel short of breath, stop and contact your doctor right away. Let's start with your plate, because what you eat can help ease swelling and support your leg muscles. First, aim to boost your protein intake. Research shows that many older adults don't get enough protein, and that may worsen muscle loss. Sarcopenia. When older adults eat more than the minimum amount, around 1.2 grams per kilogram of body weight, rather than the typical 0.8 grams, they tend to keep more muscle and strength. That stronger muscle, especially in your calves, helps your circulation and naturally reduces fluid pooling in your legs. Good sources of protein include lean meats, fish, eggs, dairy, beans, and nuts. Try to spread protein reasonably evenly through meals. That's more effective for muscle than eating most of it only at dinner. Next, think about minerals and hydration. Magnesium is one that often comes up. The Incianti aging study found that older people with higher magnesium levels in their blood had better lower leg muscle strength. But while people often take magnesium supplements for cramps or swelling, clinical trials are mixed. For example, one randomized trial in older adults showed that oral or even intravenous magnesium didn't significantly reduce leg cramp frequency. In short, it's better to aim to get magnesium from foods like green leafy vegetables, nuts, whole grains, and beans. Always check with your doctor before starting any supplement, especially if you take other medicines. Now, let's talk about electrolytes and fluid balance. Too much salt, sodium, in your diet can worsen water retention. Public health guidelines in the US advise limiting sodium because most older adults already consume well above the safe limits. On the other hand, potassium is your friend. It helps balance sodium and supports healthy fluid control. Foods high in potassium include bananas, potatoes, beans, spinach, and yogurt. The dietary reference for potassium is about 4,700 milligrams daily, though individual needs may vary. Lastly, you can reduce swelling by choosing anti-inflammatory foods. A vegetable-rich diet has been linked to lower levels of inflammatory markers in older adults. Foods like berries, leafy greens, fatty fish like salmon, olive oil, nuts, and spices like turmeric and ginger all support a gentler way to reduce inflammation. Here are 3 simple do-this-today nutrition ideas. 1. Add a palm-sized portion of protein, like fish, beans, or eggs, to every meal. 2. Use less salt at the table or in cooking, and instead season with herbs, garlic, or lemon. 3. Include a colorful vegetable or a handful of berries at 1 or more meals to help lower inflammation. With these changes, you're supporting both stronger muscles and healthier fluid balance, 2 key parts of reducing leg swelling over time. Now, let's move together in a way that helps your legs drain fluid and build strength gently but effectively. First, start with a warm-up for about 1 to 2 minutes. Sit in a sturdy chair. Lift your heels off the floor and lower them slowly. Then lift your toes and lower them. Do ankle circles in both directions. This warm-up gets blood flowing and warms up your calf pump without straining joints. Next, your strength moves 4 exercises, each chosen to help pump fluid, reinforce muscle, and support your legs. First, seated heel raises. Sit tall, feet flat. Then slowly raise your heels. Hold for a second and lower. Aim for about 10-15 repetitions, 2 sets. If your knees or back feel twinge, just lift part way or reduce the repetitions. Over time, you can do this more often or add a little light resistance, like holding small weights or water bottles. Second, sit to stand from a chair. Use a firm chair without wheels. With your feet hip-width apart, lean slightly forward. Push through your feet to stand, then slowly sit back down with control. Try 8-12 repetitions, 1 or 2 sets. If it's painful on your knees, do a partial stand, not fully up, or use your hands on armrests to help. Third, wall squat hold. Stand with your back against a wall, feet about shoulder width, and slide down into a mini squat as far as is comfortable, maybe only 10-30 degrees. Hold for 10-20 seconds, then slide back up. Do 2 to 3 repetitions. If you have knee issues, reduce your depth or do this near a counter for support. Fourth, side leg raise hip abduction. Stand beside a chair or counter and lightly rest your hand for balance. Lift one leg out to the side. Don't let your body tilt. Hold for 1-2 seconds and lower. Do 8-12 repetitions per side, 1 to 2 sets. If balance is difficult, do fewer reps or hold onto the chair firmly. After strength, we do a balance exercise. Try a supported single leg stand. Stand next to a wall or chair. Gently lift one foot off the ground for as long as you comfortably can, even 5-10 seconds. Then switch. Work up gradually to 20-30 seconds if you feel safe. This helps your balance system and supports circulation by activating stabilizing muscles. Finally, stretching helps your legs relax and maintain mobility. Do a calf stretch stand facing a wall. Place your hands on it, step 1 foot back, and press the heel gently into the floor, feeling a stretch in your calf. Hold 15-30 seconds per side. Then do a hamstring stretch. Sit at the edge of your chair. Extend one leg forward with heel on the floor. Lean forward gently from your hips until you feel a comfortable stretch behind your thigh. Hold 15-30 seconds, then switch legs. As you repeat these exercises 2 or 3 times per week, you can gradually progress. For example, add an extra 2-3 heel raises each session, or increase your wall squat hold by 5 seconds each week, if it feels comfortable. The research strongly supports strength training for older adults. In fact, meta-analyses show that resistance exercises improve strength in people over 65, even when done just a few times per week. Always remember, if you feel sharp pain, dizziness, tingling, or sharp swelling, stop the exercise and contact your doctor. Make sure you're working in a safe space, a chair nearby to hold if you wobble, non-slip shoes, and a clear floor. These 4 moves, warm-up, strength, balance, stretch when done consistently, help your calves pump fluid better, improve leg strength, and may reduce the swelling you feel at the end of the day. You've got this, truly. Try these exercises and simple food habits for the next 2 weeks, and pay attention to just 2 numbers: how many sit-to-stands you can do in 30 seconds, and how long you can safely balance on one leg with support nearby. These tiny checks help you see real progress, even on days when your legs feel heavy. When you notice that your swelling eases a bit earlier in the evening or your steps feel steadier, celebrate it. Those small wins add up. If you're comfortable, share your starting numbers in the comments so others your age can cheer you on. And if you want to keep building stronger, calmer legs, my follow-up video on circulation, footwear, and compression basics will help you go even further. Don't forget to subscribe, and always listen to your body. This is educational, not medical advice.